SASI bypass or SASI bipartition is a metabolic and bariatric procedure. Single anastomosis sleeve ileal bypass acts mainly inducing a metabolic process through gastrointestinal hormones. First of all, GLP-1 and PYY are two hormones produced in the distal ileum and initial part of the colon. These hormones can decrease the appetite and regulate positively the glucose homeostasis, increasing production and activity of insulin. The other side, GIP and CKK, are produced mainly in the first portion of the small bowel. These hormones can delay the gastric empty and increase fat digestion. Finally, ghrelin is a hormone produced in the stomach, mainly in the greater curvature. Ghrelin adjusts both energy input by increasing hunger signals and energy output by increasing fat and glycogen storage and short-term heat loss. All these hormones are produced in the gastrointestinal tract and travels through the bloodstream, acting on different organs in the body, such as adipose tissue, brain, liver, pancreas, and gastrointestinal system. During the SASI bypass or bipartition, the greater curvature of the stomach is removed. Similar to the sleeve gastrectomy technique, this step produces two main functions. First, the patient will decrease the volume of ingested food due to a gastric restriction. Second, ghrelin production is decreased. It means that appetite decreases and metabolism increases. These functions are the main mechanism to lose weight. However, in SASI bypass or bipartition, the distal ileon is brought up and anastomosed to the new stomach. It produces a food bipartition. Some food will go through the natural way and some food will go through the intestinal loop. Food that goes through the intestinal loop will have two main mechanisms of action. 1. Decreased absorption of food. 2. And second, the food that travels through the intestinal loop bypasses partially the first part of the small bowel. It decreases PYY and CKK production. In addition, when partially digested food leaves the stomach, it goes through the small bowel, reaching the ileum and the colon. It activates strongly GLP-1 and PYY production. All these combined mechanisms help to decrease levels of glucose and produce significant weight loss.